I'm always delighted to be with Saul who's been such a leader in the conservative movement and the Republican Party.
Welcome to the Saul's Newsstand News Rewind for April 7th, 2023. A new op-ed from Saul states, Medicare's real foe resides at 1600 Pennsylvania Avenue. President Biden claims that his just-released budget proposal would help keep Medicare solvent for another 25 years. But he's playing a shell game. The proposal would shore up Medicare's hospital trust fund, but only by slashing Medicare's drug coverage to the bone. The proposal would hurt seniors by jeopardizing their access to cutting-edge new medicines and doubling down on the innovation-killing drug price controls in last year's Inflation Reduction Act. The drug provisions in the new budget would slash Medicare by an estimated $200 billion over the next decade. Democrats try hard to brand these reductions as savings, targeting drug makers rather than cuts. But the simple fact is that if Congress passes the Biden budget, the federal government will spend $200 billion less on Medicare than it otherwise would have. New price caps on drugs would be in addition to those already included in the Inflation Reduction Act, which imposed price controls and slashed future Medicare spending by $281 billion over the next decade to help fund progressive priorities like electric vehicle subsidies and wind farms. Price controls will seriously jeopardize seniors' access to the medications they need, both in the short term and over the coming decades. We would strongly encourage you to read the full op-ed by clicking on the link in the description below. The Federalist reports, even his administration admits Bidenflation is bankrupting Social Security. In its budget last month, the White House claimed that, quote, the administration is committed to protecting and strengthening Social Security. But the recently released annual report from the program's trustees portrays a different story. The report demonstrates how the slower economic growth and higher inflation of the Biden years have undermined Social Security's foundation and accelerated its insolvency. If ever a document illustrated the failures of the Biden administration's economic policies and how those failures will harm seniors, this report does it. The annual report, compiled by the Social Security actuary and approved by the program's trustees, all of them appointed by Biden, projected that insolvency for the retirement trust fund would occur in 2033, 1 year earlier than estimated in last year's report. The biggest cause for the change? A lowering of estimates for future GDP and productivity growth. The White House may not want to admit it, but in 1975, then Senator Biden introduced legislation that would sunset every federal program, including Social Security and Medicare, within 4 years. If a few more years of slow growth and high inflation jeopardize Social Security's solvency, Biden may finally achieve his long-lost wish. And finally, another op-ed from Saul states, New York must rein in healthcare costs. This won't come as a surprise to many, but one of the biggest issues facing the Americans my group serves is the rising cost of healthcare. And while state and federal lawmakers work to unravel the complicated and often opaque costs behind what patients pay, this problem can't be solved by focusing on singular parts of the healthcare universe. There are several drivers of cost, and each needs examination. The Prescription Drug Price and Supply Chain Transparency Act of 2023, in the budgets proposed by Governor Kathy Hochul and the state Senate, would impose stiff regulations on the biopharmaceutical industry to the point that future innovations could be put at risk. Clearly, impeding scientific research and access to the latest innovative treatments is not the goal of Governor Kathy Hochul or the state Senate. However, it's not hard to see how quickly that could be the result. For patients across New York, especially the seniors my organization serves, leaders in Albany must quickly scrap these budget provisions and protect the health and well-being of patients across the state. We would encourage you to read the full op-ed by clicking on the link in the description below. That concludes your Saul's Newsstand News Rewind for April 7th, 2023. For more political news faster, visit saulsnews.com.